It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, and welcome back for another edition of Best Docs Network. This is the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. We're going to get today's show started with interventional cardiologist, Dr. Annie Varughese.
Doctors on the military post couldn't tell me exactly what it was. So I was being treated for pneumonia. Then eventually I moved here to Houston. And that's when I met Dr. Varughese, and she diagnosed it as enlarged heart.
Stephen Jones, wonderful man, developed cardiomyopathy, weakness of the heart. And cardiomyopathies can occur because of coronary artery disease, blockage of the vessels that feed the heart, can happen from viral illness that can attack the heart, and many other metabolic derangements can cause problems with the heart, the pumping of the heart. What he had was a problem with the muscle, and we were able to change that by sending him to Texas Heart Institute at the appropriate time in order to get a device that could help the pumping mechanism of the heart.
Last year I had a heart pump put in, and I've been living off of that right now for the last year and a half.
Left ventricular assist device, and they come in different types, as we've talked about with several doctors at Texas Heart Institute, including Dr. Frazier and Dr. Delgado that we've shown on the show before. But here's a real live patient that we had from our practice, that was able to benefit from that technology.
I thank Annie Varughese a lot. She's been truthful. She's been up front. She let me know, even though she told me some things that I didn't want to hear, but and by her acting aggressively on this, it has saved me. And I would say I devote a lot to her.
Well, it used to be a bridge to transplant. That it was only a small amount of time that they had to wait, but now they can use that as their heart, basically. For a long time, and it's just because they've gotten smaller and better and safer.
Keeping your social networks alive and well may help benefit your ticker over the long term. Social support has been linked to a lower risk of heart disease, and people who do have heart attacks fare better if they are socially connected.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth. And George is a very outgoing person and likes to smile and has a great smile. And so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, Many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Did you know that you can request an appointment with any of the amazing doctors that you've seen on our show today? Just head to our website, bestdocsnetwork.com, go to the doctor's profile page and click on the Request an Appointment tab. And you can even request an appointment with our next doctor. It's head and neck surgeon, Dr. C.T. Nguyen.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what will be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Engaging in casual conversation with others may help keep you as sharp as doing a word puzzle, according to some studies. Just 10 minutes of daily chatter appears to improve mental function and preserve memory.
How can you tell when a lump is a bad lump or a not bad lump? And it's important to know, because bad lumps can be cancer and not bad lumps don't need anything like biopsies and doctor visits. Here's how to tell if a lump is bad. First of all, is it rock hard? Benign lumps are usually soft or rubbery, and hard lumps like a rock hardness, those tend to be cancerous type lumps. Also, if the lump that you feel in your neck, for example, or your breast, or in your armpit, or on your leg, if it's fixed to the tissues instead of nice and mobile and movable, then that's a bad sign. Fixed lumps can be cancer. They aren't necessarily cancer, but they can be cancer. And if they're movable, they're usually not. This isn't a hard and fast rule, but in general. Also, if they're growing, cancerous lumps tend to grow. Non-cancerous benign lumps tend to stay the same size or get smaller. Also, you want to know if the lump is discrete, meaning can you feel all of it? Is it nice and smooth? Is it easy to feel the borders of it? That's a good thing. If you can't feel the borders of it, that sounds like it could be cancer because it's growing out into the tissues. That's a bad sign. If you ever have any question, see your doctor.
For additional medical minutes with Dr. Honaker, head to our website, bestdocsnetwork.com, click on Education and the Medical Minute tab.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that honestly, in my practice, I probably see 10 to 15 times a day. So typically, someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle, and it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Up next, we're going to introduce you to plastic surgeon Dr. David Altamira.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. I feel sexy. I can wear a bikini where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, I wanted to get back to me. I got my sexy back.
In today's Ask the Doctor, Mark from the Woodlands has a question for Dr. Annie. Why do I need to take so many medicines for high blood pressure?
Blood pressure is regulated by multiple receptors on a cell. So if you can visualize a cell having 20 different receptors, you can realize why one medication may affect one receptor but not the others. Therefore, it's better to have multiple medications affecting many of the receptors rather than going high dose on any one medication, because high dose usually can cause side effects. So therefore, the answer to your question is multiple medications are necessary to affect multiple receptors on cardiac cells as well as vascular cells to help regulate blood pressure. Very important to take care of that blood pressure. Keep it low, protect your heart, protect your vessels, protect your life.
A few years back, I started having ulcers show up on my lower ankles. So these ulcers would take 2 to 8 months to get rid of. Once those would heal over, another one would pop up.
We did an ultrasound and discovered that he had severe chronic venous insufficiency with very large varicose veins and swelling. His biggest issues were that he had open, non-healing wounds. He had a very large one on the right side, and he had a much smaller one on the left side. He'd been seen and treated by a variety of people with a variety of methods over the years. None of them had worked.
They say, well, you know, that's not really a problem. We have surgeries that we can do on an outpatient basis. We can get rid of that for you in no time.
We very carefully mapped out which veins were bad in his legs, the ones that are running backwards, and then made sure we understood where the blood was running correctly, and we ablated selectively the bad veins to restore the venous circulation out of his legs back to normal. And that improves the overall health of the leg and improves healing, and he actually healed up very nicely.
The procedures, like I said, didn't take any time at all. Come in the morning, go to work in the afternoon, not a problem. There was no pain after the surgeries. All went well, went back to work, no problem.
You can have wounds that are unrelated to venous insufficiency, but most chronic non-healing wounds are related to problems with your veins. But if you have a non-healing wound, that is almost certainly from venous insufficiency, and we can heal virtually all of those wounds here with the procedures we do.
Having the circulation back in my lower legs allows me to work longer. It allows me to stay on my feet longer. I don't have the foot pain that I had prior. The procedures helped dramatically.
On our website, we have an interactive map that can help find the doctor closest to you. And that could be our next doctor, bariatric surgeon, Dr. Robert Marvin.
I weighed 236 pounds. It was just time. I needed to do something to feel better, healthier. I needed to feel healthier. I needed more energy. I needed to do something. I had the lat band as opposed to the sleeve or gastric bypass because it was less invasive, and it was really the right decision for me personally.
She's increased her exercise in response to having the control to lose the weight more easily. So there's a positive reinforcement there. If they do the right thing in terms of exercise, if they're consistent, then they see a bigger drop-off than they had seen before they had the surgery.
As time went on, I started dropping the weight, eating, slowly, liquids and then your soft foods, the way that you were told to do it. And things just started to work out for me. I started exercising more, and eventually it just started falling off.
Right now she's running, she's trained for a half marathon. And those are great things in terms of the exercise side of taking care of the weight. When it comes to eating, it sounds like she's doing a fairly good job switching to things that are lower calorie, less animal fat, and lower glycemic index. But it sounds like something, occasionally she eats things that aren't ideal for her. But I think her exercise takes care of that, and that's why she's at ideal body weight right now.
Physically, to be able to not huff and puff going up and down a flight of stairs, mentally, to work, to educate yourself, I think it makes it easier to feel confident about yourself. It makes things that much easier. Before the surgery, I was 236 pounds, and 3 years later, I am down 85 pounds.
Unfortunately, with a lap band, it's difficult to tell sometimes ahead of time who's going to do well and who's not going to do well. And we have patients that do very well with it, and that's great. The problem is the predictability when it comes to the lap band. So she's an example of someone who's used it as a tool the way it's supposed to be used. Unfortunately, that isn't the case with everybody.
This is such a fabulous event. It's called Go Red for Women, and it's putting together women from the community, physicians, hospitals, everybody supporting women and heart disease and the awareness for women to protect and support. Even children can benefit from this event. So I think it's so fabulous, and that's why I wanted Best Docs Network to really talk about it.
My speech today is going to be about how I'm dealing with heart disease and how to have an optimistic and positive attitude while going through something or anything difficult in your life. I keep laughing, I keep smiling, try to stay positive about things. I could be stuck in the hospital, but instead I'm home with my family.
The biggest way to prevent these problems is education. So the main reason for this type of event is to educate, and through that we raise funds and can get the word out.
Number one, it educates people on what has happened over the last several years, and it brings to the forefront, with women in particular, with Go Red for Women, to listen to your body and know your symptoms.
The most important thing about cardiovascular disease is the #1 killer of women in this country. And 50% of women or men with cardiovascular disease die suddenly, without any symptoms, without any warning.
I just believe getting the word out to women especially. We always are tired and run down and raising kids and going here and there, and we might just think, oh, we're just tired, my neck hurts for some reason, and it's no big deal, but it could be a sign of a heart attack or a stroke.
And women, we're just, and they're, as we know as men, are different. And they present differently. Fortunately, stroke-type symptoms are about the same, but again, another large focus for us is heart disease, and they are completely different in the way they present as a general rule than men.
Cardiovascular disease and the awareness for women is such a tremendous topic, and that's why Go Red for Women is such a marvelous cause, and I just want everybody to support it.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically two groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is, the majority of the time, a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bid on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was at Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country, and my dad was wounded in the South Pacific in World War II. And I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
That's going to wrap up today's episode of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are making a difference in people's lives. If you have a question or comment, we love hearing from you. Send us an email at info@bestdocsnetwork.com. Thanks for watching, and we'll see you next week.